As of the 9th of April, 12 noon, we've seen 287 new cases confirmed and diagnosed to have COVID-19 infection. Of these 287 cases, 3 were imported cases, 219 were linked to clusters, 19 were linked to other cases, and 46 cases remained as yet unlinked. Epidemiological investigations and contact tracing continue, and we will continue to establish links as they become evident to us. Of the new cases that were linked to clusters, the majority of them, in fact, were cases linked to the dormitories. Many of these come from the S11 dormitory, and there's at least 160 cases from this particular dormitory. But the number does not reflect necessarily the number that were truly symptomatic. We've, in fact, started active case finding and are swab testing workers in the various blocks in the dormitory. And many of the cases that were test positive in this category were, in fact, workers who have very mild symptoms or were well. Our epidemiological investigations continue, and we have successfully linked several clusters together. And this is with the assistance of the Singapore Police Force as well as MINDEF. Preliminary links have been established between the cluster at the Mustafa department store, the Project Glory construction site, as well as 5 dormitories. And this includes the S11 dormitory, the Tampines dormitory, the Toh Guan dormitory at the Sungai Tengah Lodge, as well as Cochrane Lodge 2. Many of these cases started out, in fact, with a cluster at Mustafa, of which a number of these were employees at Mustafa. And when we believe that workers had visited Mustafa and they subsequently transmitted infection to their co-workers, either at the Project Glory construction site or to other residents within the dormitories that they lived in. The transmissions most likely occurred through close contact, for example, at meal times, during breaks, but also between co-workers at work due to physical proximity at the work site, and subsequently to colleagues and friends within the dormitories as they engage in social activities. In total, we have 1,910 cases of confirmed and verified COVID-19 infection, of which 884 remain admitted in hospital, and 29 of these cases are in the ICU. We have had 314 cases discharged from acute care and 705 cases decanted to a community isolation facility or a step-down facility. 7 cases have passed on. Of the cases that were decanted into an isolation facility, the community isolation facility, 108 have completed isolation and returned home. Of those that were, in fact, were looked after within our private hospitals, there was an additional 38 that completed isolation. So in total, 146 cases have completed isolation and have, in fact, gone home. With regard to the dormitory, we've been working very closely with the Joint Task Force that's led by the Ministry of Manpower, the Singapore Police Force, the Ministry of Defence, Singapore Armed Forces, and we provide the medical support for workers in the dormitories who are ill and fall sick. In the dormitories which are of concern and which we have identified as isolation areas, we have set up medical posts, and the medical posts have medical personnel who looked after these workers as they present with symptoms. We've also, in addition to the medical posts, performed active case finding, going in to look for workers who are not well, and then, if necessary, to bring them down for further assessment. When we pick up symptomatic workers, we would make every attempt to isolate them and prevent them from then mixing with other workers within the dormitory. We will test them, and if they are tested positive for COVID-19 infection, we will continue to treat them in our hospitals or in our community isolation facility as it becomes available. Those who are not tested positive but remain symptomatic from the infections that they may have, we will keep them separate so as not to also have further any infection spreading to other workers in the dormitory. And as we extend our reach to reach out to all workers in all the dormitories in Singapore. We will continue to establish more medical posts in phases.